Good evening, all, and good evening, respected doctors, for joining today's session, which is of most important for the patients and people awareness on the occasion of World COPD Day. This year's World COPD Day campaign is moving around Your Lungs for Life, which is very, very important that in last 2.5 years, we have seen the COVID impact on the lung, direct impact of the COVID-19 on the vital organ lung, and we have seen the morbidity and mortality across the world. Therefore, the Your Lungs for Your Life is most important. For the people and the patients, it is most important living life with the COPD. What are the facts about it and what are the fictions? This is making us too easy to understand our disease, which is the chronic and lifelong, and the fictions which we will remove and take the proper and appropriate medications and visit our healthcare professionals, our physicians, our doctor society. Therefore, COPD is having the major impact on quality of life, including imposing limitations to the ability to work, normal physical exertion, household chores, social and family activities, and sleep patterns. For this discussion, we are having today with us the three eminent pulmonologists, those who are present here today for the discussion. I will just having their brief introduction. The youngest one amongst us is Dr. Samir Arbat, who is the respiratory medicine experts from the central part of India. And along with us, the eminent and senior Dr. Rohit Kumar from Delhi is there. We are having Dr. Arpan Shah, who is practicing at Vadodara with Pranayam Lung and Heart Institute at two places, Kareli Bagh and Raupura. With this, I'm going to get the expert opinion on this, which will be helpful for our patients and our population when they see their important opinion on the COPD on the occasion of World COPD Day today. I am now starting with Dr. Arpan first. Dr. Arpan, what is the COPD? People say that COPD is a rare condition. What is the truth about COPD?
First of all, thank you, Dr. Kunal, for this kind introduction. And let me tell you that COPD, as is commonly known as chronic obstructive pulmonary disease, is the myth about it is that it is rare. It is not only very common, it is very, very common. In fact, if you look at the global statistics through the WHO guidelines, WHO, it's the third leading cause of death worldwide. Close to 4 million people die across the world every year. And if you look at the Indian statistics, more than 500,000 population die because of COPD. So it's very, very common, and particularly in a developing country like ours, where a lot of rural population is there who are exposed to biomass fuels. This is a very common disease.
Yes, you are very correctly stated, Dr. Arpan, about our load of burden of COPD or lung disease itself on Indian population is very large. Our recent yesterday's calculation is 142.87 crore is the Indian population, which is diversified into rural, urban, and also the urban population is exposed to the air pollution due to automobiles, and the new entity in the North India, what we have seen that about the air pollution, which is highlighted on the news channel. Yes, the COPD is not the rare and it is increasing. Second question, I'm moving to Dr. Samir. It states that only smokers develop the COPD. What is the truth behind it?
So this is a complete myth. For a very long time, theoretically and clinically, we've been inclined to know that smokers are the ones who come to us with COPD. But what we've understood is a good chunk of more than 30% of COPD patients are non-smokers. So these are basically patients who have been exposed to secondhand smoke, women who've been exposed to chulha smoke or biomass fuel smoke, a lot of population who are exposed to indoor air pollution, and there is a subset of people who have some genetic predisposition and asthmatics who've been uncontrolled or been without medication. So there's a huge chunk of population which we are still not very much aware about, who are suffering from COPD but have been non-smokers all their life.
Yes, Very correct. What you have stated that, and it is the smoke from where it is originates and what the population is getting the active smoking exposure or passive smoking exposure. When we talk about the smoking, it is not only related with the smokers of the cigarette smokers or other related things, but the smoke generating for various modalities. Now I'm moving to Dr. Rohit. Sir is in at Delhi capital. This is highlighted for last 2 weeks for the air pollution. Sir, as the 142 plus crore of the India population, the senior citizens or the elderly population is growing a lot with the morbidity, comorbid conditions, importantly diabetes, heart disease. So what you say is that only older adults or senior citizens develops the COPD. What is the truth behind it?
So, they are, most of the patients are of that age group, but it is not like that any age group is not susceptible to them. So it's because years of smoke exposure ultimately leads to it. But you will come across, large number of patients who come from from the 40 to 50 age group category also. And another thing is there are certain genetic disorders which predispose the individual to deteriorate very fast. So even some years of smoking can make them develop COPD. So if a patient has something like alpha-1 antitrypsin deficiency, it's quite possible that they can have COPD at a very young age too. So I think it's a myth to say that it can only occur in the elderly, but yes, most of the patients are elderly because it's because of the cumulative effects of smoking over the decades that they've smoked.
Right, very correct. So all across the age group, the risk of developing COPD is true. Now, yes, the quality of life when it comes, so diet, exercise, keeping fit is a mantra for everyone. Dr. Samir, what is your say is that the people with COPD, can they exercise or they cannot exercise?
Yeah, so when we talk about exercise or physical activity, so there are two problems that we face with COPD. One is the downward spiral. So what we see is because of COPD, the patient has certain limitation of activities because of which he or she is unable to fulfill his daily routine or go for exercise. And eventually this leads to more problems which arise with COPD again. So this is called a downward spiral. And second problem is the perception of symptoms. A lot of times COPD patients are used to sedentary lifestyle. They don't actually push themselves, and that's when then they don't realize the level of symptoms that they're actually facing or the level of disease that they might be right now used to. So because of this, we always recommend our patients to do some physical activity, to do some exercise. Although when this exercise is done without a proper guidance, such patients can face some difficulties. So that's where pulmonary rehabilitation, a program called pulmonary rehabilitation, comes in, wherein the patient is given guidance in how he or she can maximize his or her physical activity with minimum efforts or minimum oxygen consumption. So in a way, exercise is a part of management of COPD, which has to be done in a guided manner through a pulmonary rehabilitation program.
All right, very perfect. I catch up the word that pulmonary rehabilitation, and that is really giving them the correct way of doing the exercise and maintaining and remission of the COPD, and they can control very well their signs and symptoms for the long-term period. Dr. Arpan, when the patient diagnosed with the COPD, they feel that it is a lifelong and what the treatment, whether they will get the good outcomes. So what you are saying is that if there is a no treatment for COPD, or we can treat the patients very correctly with the COPD?
Yes, Dr. Kunal, that's a very good question to be brought forward here. It's not that no treatment is available for COPD, but the problem is the treatments that are available, the stigma associated with that kind of treatment with common public for the inhalation therapy, that causes this issues of patients developing a myth that there are no treatments available for COPD. The most common treatments and the most beneficial treatments available for something like COPD, which is primarily an airway disease, are inhalation therapies. But as a lot of patients come from rural background for COPDs, they have a big stigma associated with inhalation therapy, and that causes all of these issues. As of now, there are various treatments available. GABA, LAMA, and inhaled corticosteroids are available. And as Dr. Samir pointed out, that pulmonary rehabilitation, that is one of the major aspects of the COPD treatment.
Right. Very correctly stated, Dr. Arpan, and it is very much convincing and happy to hear for the patients that treatment is available and pulmonary rehabilitation is comprising exercises, guidance, and medical management, which controls the COPD over the long term. Dr. Rohit Kumar, this question's to you because as India is known for the pulmonary disease, importantly tuberculosis, then followed by the asthma. So many times patients or people feel that the asthma and COPD is the same. So what is the difference between this?
So, there are two schools of thought. One says that it's a common disease and it's one spectrum. There's the other one which says they're quite different. So there's the British and the Dutch hypothesis. But fundamentally, treatment-wise, there is a difference. And mind you, there's also a condition known as asthma COPD overlap. So you have some patients of COPD who can have an eosinophilic phenotype, and they may respond to certain asthma-specific medicines. And you do have COPD, asthma also, if not treated, which becomes a remodeled asthma, it behaves phenotypically like a COPD. So there are times where clinicians face this difficulty, and it's very difficult. You can have late onset asthma, and there are certain criteria which help us differentiate, but they are not always white and black. There's a gray zone too. So as clinicians, we do face that problem, but in most patients, the diagnosis is quite straightforward. So in childhood, it's mostly asthma. In the elderly, we are having this confusion at times. Then there are certain tests that a doctor can do which can help us differentiate. A pulmonary function test with reversibility can help us dissect out which of the two conditions is the patient having.
All right. Very correctly stated that in a short, we can take a message from you that the asthma, COPD, or the both can coexist, and it is important for patients to go to the expert with the pulmonologist and get diagnosed periodically. So every stage of the life can make it changes, the environmental pollution, the aging, or other comorbid conditions. Yeah, it is very important that to distinguish between asthma, COPD, if coexist, then go to the specialist pulmonologist to get diagnosed and treated well. Yes. Dr. Arpan, you are from Vadodara. Gujarat is a mostly pure vegan state. Obesity is quite significant. Indian population is exposed to central obesity. So what is the impact of body weight on the COPD, and what are the myths behind that?
Dr. Kunal, you rightly pointed out, we Gujaratis are very fond of sweets. And if we look at India as one of the diabetic capitals of the world, but if you look at it, even into subsets of it, Gujarat would come first amongst all the states. Well, COPD primarily is a systemic disease. So having an overweight body would predispose those patients to more symptoms of COPD, and the long-term prognosis is always guarded. So of course, heavyweight, high body mass index patients having COPD would have a poor prognosis in the long terms. There are a lot of studies conducted over that.
Yes, very well stated, Dr. Arpan. Yes, and it is not the problem only in the state of Gujarat, but it's across the country. Overall obesity is increasing, which is increasing from the school age or the childhood obesity, which predisposes the higher risk of developing diabetes and the pulmonary disease if they develop COPD and asthma, which they get a more morbidity in their lifetime. Now this question is to Dr. Samir that for the COPD patients, the patient is already diagnosed with the COPD. So whether they quit the smoking or not, will it have any impact?
So there's always a definite advantage of whenever you quit smoking, and a very important role here is because smoking itself leads to a lot of exacerbations in COPD patients. So that is something that affects the quality of life, and it is also responsible for accelerating the decline in lung function. So a person who continues to smoke will have a lot of problems, a lot of exacerbations with COPD, and at the same time this patient will now be exposed to other systemic disorders, which includes basic muscle wasting, osteoporosis, and even the risk of lung cancer. So whenever you quit smoking, the earlier you quit, it is better. Even if you have been diagnosed with COPD, you will have a better quality of life if you quit then and there.
Yes, very well said, Dr. Samir. And we are thankful to the regulators and the government agencies and the constant pressure that on the cigarette packs there is a cancer, very serious and horrible looking cancer patient specimens pictures are there. And there is an overall ban across the public places of the smoking. And yes, it is correct that the smoking cessation or complete stoppage of smoking is important. Uh, Dr. Samir, about the breathlessness, and the COVID has taught us that the oxygen saturation, right, 90, less than 90%, more than 90%, and each and every person across the world is aware of it. So, what is about is the COPD is only the shortness of breath or something more is into that?
So COPD has a lot many symptoms other than shortness of breath. So no patient should either get misguided or misdiagnosed on the fact if he or she is not presenting with breathing difficulty, because cough and phlegm production is a very important part of COPD. And what I want each listener to know is that COPD is a systemic disorder. It is not limited to the lungs. So there is a whole battery of symptoms which a patient of COPD can present with, which starts from muscle wasting, weakness. Patient might have symptoms of mental issues such as depression, anxiety, and these patients often have issues related to bone health and many other disorders. So shortness of breath is a very small part of the spectrum of symptoms that a COPD patient can have.
Yes, very right that it is what we see. It's the tip of the iceberg. What we see is not the real truth. Many underlying pathophysiological conditions are below, which may worsen the patient's condition. Yes, very correct. Dr. Rohit Kumar, we wanted to know about the relationship between the healthy diet and COPD, as we know that diabetes, heart diseases, hyperlipidemia, diet and exercise is a prime important. What is the myth about that the COPD is related with the lung and healthy diet cannot help it? Can you brief and highlight on this?
So, no doubt that this is just a myth. Now, Dr. Samir had spoken about pulmonary rehabilitation. And one important component of pulmonary rehabilitation, other than exercise, is a good nutrition, patient education. And, nutrition is one thing that is quite neglected. So many people, because of their addictions or whatever, will disregard the nutrition, often disregard their symptoms, and over a period of time, this poor nutrition also predisposes them to further infections and exacerbations. So all said and done, as physicians, it's our role not just to prescribe medicines, but even give them advice regarding rehabilitation. And I would restate this point: essential component of rehab is nutrition advice.
Would you recommend that in pulmonary rehabilitation, the dietitian or nutritionist will be also the one important team member of yours?
So yes, pulmonary rehab is a multi-component, approach, and one essential component is nutrition. And a dietitian, there are centers who do not have a dietitian. We are lucky to have a center where we do, but if you do not, even then, a physician can give a good amount of advice, and that will that at times has a bigger impact on the patient. But yeah, if you have the facility, always have a dietitian there.
Yes, very good advice that if you have a facility, it is a better. So always for the better and quality of life, we should be having the dietitian and nutritionist in the team to manage the COPD. And Dr. Arpan, tell us about that. Many says that I haven't got the COPD. Patient may deny to get diagnosed as a COPD. They just said it is a smoker's cough if they are having the history or they are the habit of smoking.
See, first and foremost, I would like all listeners out here to remember that any cough that is more than 2 or 3 weeks old needs to be addressed. You cannot take a commonest symptom such as cough very lightly. And the best way to diagnose, particularly when you are a smoker or you are exposed to biomass fuels in indoor environments, is to consult a nearby pulmonologist and get a very, very simple test known as pulmonary function test, which is most commonly known as the PFT, to be done. And based on that, we can diagnose whether the patient is suffering from COPD or not, and then stage accordingly.
All right, very correct. So differential diagnosis and definite diagnosis and identifying the cause is very important. What we get out of this. Dr. Rohit, we wanted to know that. So is there possible to completely cure COPD?
So by definition, it is irreversible, but you can always halt the progression of the disease and you can prevent it. So, instead of, reversing it, let's focus on preventing it. Let's have, smoking cessation programs in place. Furthermore, if you want, you can treat it, but to reverse it, it is not just possible.
Yes. Yeah. So after diagnosis, continuous following with the pulmonologist, taking proper advice, and living the life with the pulmonary rehabilitation. That is what we are offering to your patient is very important. Yeah, that is very correct. And is the early diagnosis is important in controlling long-term control of the COPD? Dr. Arpan, can you tell us on that? How much is important
Yes,
the time to diagnosis in the age of the patients?
Yeah, see, as far as diagnosis of any disease across the spectrum is concerned, early diagnosis always helps you to lead a healthier life, helps us to address any kind of symptoms or complications very early on and tackle it in a far better way that a patient can live a healthy life. As I pointed out in my last answer that it's a very simple test. We're supposed to blow into the machine and it tells you the capacities of lung. So once a patient has been subjected to a PFT, he's staged according to the GOLD criteria, which is an International Society for Classification of COPD and Staging of COPDs. So once they are staged, the treatment is started accordingly. And the most common and the most effective treatment for COPD patients is the inhalation therapy. I would like to reiterate here that there is a lot of stigma attached with the inhalation therapy, specifically with the rural population, that needs to be addressed. And it is for the common good for the people to start the inhalation therapy as early as possible, along with pulmonary rehabilitation in the later stages of COPD.
Yes, it is very, very correct that using the inhalation therapy for whenever the patient at whatever the lifetime of the diagnosis, the correct treatment, inhalation therapy must have to be get continuous. Yes, so this message is very important for our patients. Dr. Samir, it's very important that the lifestyle changes. Will the lifestyle changes and which type of lifestyle changes will help for the COPD prognosis?
So COPD basically is a disease which is lifestyle oriented. So it is very essential that the patient has to first quit smoking. So if the patient is a smoker, he or she should enroll himself or herself in a smoking cessation program. That is a very structured program to actually achieve the results of smoking cessation, because otherwise it's a very difficult and a very uphill task, which is not very easy to achieve for a normal person. So it starts with smoking cessation, wherein you consult a pulmonologist, enroll yourself in a program wherein you are guided in how you can quit smoking. Then it is followed by a very important part which Dr. Rohit had said is nutrition. So a patient has to undergo a structured nutrition program with exercises which are part of pulmonary rehabilitation. And eventually all these lifestyle changes are what are going to increase the quality of life and decrease the exacerbations for a COPD patient.
Right. Very well said, Dr. Samir. One more question to you. As diagnosed with COPD, living life with COPD, is the COPD the direct risk for developing other diseases?
So as I had mentioned before, COPD is a multi-system disorder. We should not consider it as a disease of the lungs only. So most patients with COPD can have a high risk of developing diseases of the heart, musculoskeletal diseases, and some problems with cognitive behavior and anxiety and depression. So a patient of COPD is unfortunately surrounded by a lot of system disorders which can affect the quality of life very severely, and hence all the preventive measures have to be taken very seriously.
Oh, yes. So we do really understand that the COPD is not only the one entity in patient's life if diagnosed, but it is involving the multiple organs. Important, you stated that the psychological or mental health of the patient is very important to take care of. Now we are moving to the diagnosis, right? How to diagnose COPD. Dr. Rohit Kumar, please tell us that is a X-ray. Everybody knows that if lung disease is there, the X-ray has to be taken first. Do the only X-ray is the important diagnostic test, or there are any more other important things?
So, in fact, the role of X-ray in COPD is not just to look for signs of hyperventilation, which are seen in the very later stages. Role of X-ray is actually to rule out other causes of breathlessness. Now, Dr. Arpan actually function test, which will help us not just diagnose COPD, but also assess the severity of COPD to some extent. And other than that, one simple test that anybody can do at any clinic, even at a general practitioner level, is actually history taking. So I think that's one thing that everybody should be aware of. They can screen for COPD and ask for the history of exacerbations, assess the degree of breathlessness, and that also gives us an idea of not just the diagnosis of COPD, but the severity of COPD.
Right. Very correct. So there are now, as the technology and science is advancing, there is many more and specific diagnostic tools are available. So we cannot based on only one. So specific investigation and diagnosis help us correctly to manage the patient and put them in pulmonary rehabilitation to live the best quality of life. Now, next question is, I will ask first to Dr. Arpan, and then I will take this expert opinion from Dr. Rohit Kumar. The thing is that about the exposure to the biomass smoke, is this a major risk factor in India and how much it is impacting to the patient? And after Dr. Arpan, I want Dr. Rohit Kumar, who is the capital of Delhi and which is on all the news channel for last more than 2 weeks. First, over to Dr. Arpan on the biogas smoke and risk in COPD patient.
Yeah, if you look at the Indian subcontinent, almost 40 to 60% of the population use a lot of biomass fuel for their everyday use. That is number one. Number two, the construction of houses in the rural areas where there are very poorly ventilated kitchens and everywhere. And if you look at it, see, whenever when we are talking about a non-smoking COPD, it's the duration and the amount of exposure that gets to those patients that is factored in. So if any housewife we take, say she cooks for say about a couple of hours a day, she'll be exposed close to 25 million particulates of biomass fuels in her lifetime. So those kind of patients do develop COPD over the years. And the good part is that over last decade, there is a lot of focus on the non-smoking COPD patients. And particularly as you pointed out that Dr. Rohit Kumar would also opinion, because Delhi is becoming with the air quality index of Delhi is going down day by day. I think he'll be encountering more such patients in his practice.
So I come from the notorious city of Delhi, which is now the pollution capital of our country also. Yes, I couldn't agree more. The cause of COPD is not smoking, it is noxious inhalation. And that noxious inhalation can be outdoor air pollution, or personal air pollution. That's smoking for me. So indoor air pollution, as Dr. Arpan said, congested houses, more with poor ventilation, and they're using biomass fuel, the amount of exposure is very high. In fact, I remember we had done a study where we measured the indoor air pollution after the chula was burnt. And for 8 hours, the air quality was very horrible inside the house because the ventilation is this poor. So that also, contributes to patients developing COPD. And in Delhi right now, what we're facing is not just air pollution as a cause of COPD, but as a cause of, exacerbations that patients are having. To put it in layman terms, it's the a lung attack kind of a thing, a worsening in their symptoms, which is occurring because they've been exposed to such high levels of air pollutions. And it's not just causing COPD, but worsening it. And with every exacerbation, the quality of life goes down. Patients take a long time to recover, and some may not even completely recover. So these are important aspects that we need to address, in a personal and in a community level, for us to make a change.
Dr. Rohit, can you just highlight for all of us that in your last decade of practice, has the ratio of non-smoking COPD compared to a smoker's COPD has increased or has?
So I still see a fair population of smoking and non-smoking COPD. In fact, I still remember the very first non-smoking COPD that I saw when I was doing my residency. It was a gentleman who used to do Havan, and because he was a I asked him, do you smoke? He says, no, I don't smoke at all. So then I asked him, what do you do? He's like, I'm to pandit aadmi hai. हम नहीं करते smoking, but हम हवन करते हैं, उसमें धुआं काफी हो जाता है. So that was just a small thing that I just remembered, so I thought I'll share it with everyone. The thing is, in the last few years, yes, we have seen more exacerbations, and usually during this season. So, the winter season with Diwali and all these the air pollution going really bad at this time of the year. But yes, in the last few decades, I mean, I'm not experienced enough to talk about decades, but going by evidence, we are diagnosing COPD better. And that may be one of the reasons why we're seeing a lot of non-COPD, non-smoker COPD also.
I think early diagnosis will always be the key.
Yeah.
Yeah.
Your inputs on this?
I think so. Public education is the most important part, because unfortunately our lungs have this shortcoming that there are no pain receptors, and mostly patients with lung cancer and COPD do reach us at a very later stage. And this is something which has been the problem even in developed countries like Italy, USA and all. So public education and awareness is something that we are doing right now, is the right way to go ahead. Because A, you need to prevent it, and B, if it's happening, then we need to catch it as early as possible. So the narration has to be something which people should understand, and it should be out in the public discourse as to how air pollution and smoking both affect your lungs and how serious it can be.
Yeah, so that's a very nice thing that you pointed out about lung having hardly any pain receptors as far as COPD is concerned. And that is one of the reasons why it's diagnosed so late.
So people often have a pain in the chest, and that's why cardiac diseases are diagnosed very early and are given their due importance. And that is where the lungs tend to take a lot of insult, but once it has happened, then there's no going back.
Yes.
Yes, very correctly stated. And yes, you have importantly mentioned about the points about biogas, air pollution, the time of diagnosis. Dr. Rohit Kumar, you are seeing the mass population, not only the Delhi, but the North India. So what you will give advice to our viewers, what type of preventive measures they should take during this winter season and when the particulate matters are highly dense in the air?
So with regards to COPD, one thing that I'll say, the definition itself says that it is a preventable disorder. With regards to air pollution and the exacerbations, now, there are a couple of things that people can do. So one thing that I teach my patients is to look at the AQI. You have the weather app, which tells you what the weather is going to be like when, it's going to be sunny or cloudy, but you should also look at the AQI. And if you look at the AQI, it gives you a color code. So with green, good, go out, have fun. When it's yellow, simple rule for my patients, they should stay inside. And once it's red, everybody should stay inside. And that's assuming that, the indoor air pollution is less than the outdoor air pollution. So I think teaching people how to identify AQI, again, because, we're talking of PM 2.5. As Dr. Samir said, our lungs cannot tell us about air pollution. Even our nose cannot tell us about PM 2.5. You only can get to know about it from the sensors. And if you look at the ambient air, nowadays, with phones, it's really easy to find out what the AQI in your vicinity is. And if it's high, please take all precautions possible. Now, this is once the air pollution is already there, but there are things that we can do as a community to mitigate air pollution, which is source control. Rather than controlling our symptoms or treating our symptoms, let us control it at its source. And that again requires participation of just everyone to help out.
Yes, wonderful. We are now coming to end of the session, and it's a really wonderful interaction about what are the facts about COPD and what are the fictions about COPD amongst the people. This will help the patients, their family members, and caregivers. To conclude and summarize, I want each one of you to give the advice to our viewers, our patients, on this occasion of the World COPD Day. We begin with Dr. Samir, followed by Dr. Arpan, and then concluding remark by Dr. Rohit Kumar. Over to you.
So I'll have to, yeah, I would like to state three ways. So one is don't smoke, or if you're smoking, so quit smoking. Second is a healthy lifestyle, which includes a good amount of exercise, a healthy diet, good sleep. And last is get yourself vaccinated, because a lot of respiratory diseases are exacerbated with infections, which are completely, if not preventable, but controllable with the vaccines. And we have vaccines available for viral and bacterial infections.
Yes. Yeah. We lost Dr. Arpan. Dr. Rohit Kumar, you continue, please.
So I couldn't agree more. This, preventing, treating, mitigating its effects, these are what we need to focus on. And the theme itself says that we just have one, I'm assuming there are no lung transplants, but we just have one set of lungs to live with. And our whole life, these are the only set of lungs that we have. We have to take utmost care of them. So why smoke and injure them? Why inhale bad air and injure them? And if you develop COPD, we should not be shy of taking treatment. We should not refuse an inhaler, which can really save us, improve our quality of life. And the other thing, rehab, nutrition, those are somewhat neglected. And I think as physicians also, we need to be more aware of them and realize how useful these techniques are in managing our patients.
Yes, thank you very much. Yes, Dr. Arpan, you have got back. Please give your advice to our viewers on this COPD day.
My take-home message is, one of the best things to come out of COVID is the use of mask. And I think Sabita has already pointed out use of vaccinations, early diagnosis, and the use of inhalation therapy. But I would like to point out here that please continue using masks as and when required. Possibly, if you're living in a city like Delhi, that kind of an air quality index, I think continuous use of mask will help you prevent disease in the long term, number one. And for those already diagnosed with COPD, it would help you in preventing the infections that you most commonly catch.
Yes, very true. And this is all your messages will be very much important for improving patients' quality of life, living life healthy and happy with COPD.